Legislation to raise the minimum wage from $7.25 per hour to $10.10 per hour failed to pass the Senate this week. Do you support raising the federal minimum wage, and if so, why? If not, what measures, if any, would you propose to help low-wage earners move up the economic scale?
You know, just this afternoon, something came across my desk. The minimum standard of living it takes for a single woman with 2 children in North Dakota is $43,000 a year. At $7.25 an hour, that person is making approximately $15,000 a year. That's a big gap, folks, and we need to change that. I do support raising the minimum wage. However, I think I would like to see it graduated over time as proposed. But let's exempt out certain segments of our population, those under 18, maybe some of those in college. But let's face it, when I was in college some 40 years ago, I could earn my college tuition in a month working on the farm. Today, it's astronomical what those costs are. Those college kids need their money too. Do I support raising the minimum wage? Yes, I do over time. I talk to many business people in Fargo, and guess what they say? We're paying more than that today. It's not going to affect us. So why the big deal? Let's give people a living wage. Let's get people up to where they can afford to raise their children in a fair and honorable society where they can have the things they need. Kids can have a great education, and we can build something for our future. Thank you.
I do not support raising the minimum wage. I can't even see the sense in raising the minimum wage. The Congressional Budget Office, nonpartisan I might add, showed that we would lose 500,000 jobs in this country by raising the minimum wage to $10.10. Now, here's the good news, folks. You get a 100% increase or a 50% increase in your salary. The bad news is that this is your last day of work. If that's moving forward, I was raised wrong. There are lots of things we can do. How about we restore a full-time job to 40 hours a week instead of 30 hours a week, which is what the Democrat healthcare plan does. We passed a law that actually does that. Guess what that does? That increases your wages 25% on one vote. But the president has threatened to veto, and the Democrat Senate won't take it up. When I grew up in kindergarten, 40 hours was a full-time week. My dad always put in an extra 10 or 20. George says he was raised with a strong work ethic. We are destroying the work ethic in this country by our policies. Destroying it. The president wants the 13th consecutive increase or extension of the unemployment benefits at a time when it's been going on for almost 6 years, and every state that has done that loses jobs because nobody wants to invest there. We've doubled food stamps by doing away with, including categorical eligibility, which means you just automatically qualify if you qualify for anything. And consequently, we have created a scenario and a culture where it's just as valuable to not work as it is to work. And we're robbing people of the dignity of a job. North Dakota is the best example of all, isn't it? Create opportunities by reining in the government, keeping taxes low, welcoming business, and you create not only jobs, but really good jobs. I had the niece of a Walmart greeter call me and say, please don't let them raise the minimum wage. My uncle will lose the only job he could ever have, and it's everything to him.
I'm not in favor of raising the minimum wage either. My take on that is that what we're really doing there is we're hurting small businesses that have small amounts of employees that are on a tight budget. There's thousands of those businesses in North Dakota where maybe it's a mom and pop store and they have a couple of 2-3 kids or younger people working for them. You raise those minimum wages, you're also raising the payroll taxes that those employers have to pay, and it all adds up. And the question for those business owners then becomes, do we want more workers making, or fewer workers making more money, or more workers making less money per hour? And that's really what the question becomes. Any business that incurs more costs is either going to relieve themselves on the labor force side, or they're going to raise prices in order to cover the extra costs that they incur. When they raise prices, the low income earners in our society pay more for the products that they make. So I would not be in favor of raising the minimum wage.
Next question will be for Mike, and it will be for George. I don't know if Kevin, I'm sorry. Scoot up.
Do I get a minimum wage for passing this mic around?
Yeah, please.
With 8 million people having signed up for insurance coverage through the Affordable Care Act exchanges, how would you approach it going forward? If you favor repeal of Obamacare, how would you handle those who have already signed up?
Well, first of all, we just learned today that about only a third or less of the people that have signed up, of those 8 million, have actually paid their first premium, so I'm not sure what constitutes signing up. Is the other thing we don't know, because the administration's been less than forthcoming with information and data, is that we don't know whether those were people that had insurance previous or not. We don't even, most likely it was a net loss. So I don't know that I would really consider that much of a victory. I think that we need to repeal the Affordable Care Act, and then we need to work on something bipartisan, because the founders made it difficult to pass legislation on purpose. They created 3 branches, bicameral legislature, because you're not supposed to pass massive sweeping changes in a partisan manner. We can do some things like I think put more federal dollars and support into state pools for high risk that allows people with pre-existing conditions to get health care. We've done that in North Dakota for about 20 years. It works quite well. Thank you very much. We can allow purchasing of insurance across state lines, which is putting the marketplace to work for the consumer. We can provide the individual with the same tax benefits and deductions for paying for their health care coverage as we give to business, and we give small business the same advantages and the same level playing field as big businesses get. We can do things that put control back in the hands of the employer, and back in the hands of the patient, and back in the hands of the doctors. But we need to do something in a bipartisan manner. And the President's Affordable Care Act, let's face it, folks, it divided this country. It did more than simply dividing a government. It divided the country, and we haven't really repaired ourselves since that time. And so we have a divided government with a diverse country. We can have divided solutions and diverse solutions, but we need to come together in a bipartisan fashion and pass a good health care act that has the consumer, the patient, and the doctor first.
I'm not in favor of Obamacare either. I'm a victim of Obamacare. I liked my plan, couldn't keep it. Had to get a new plan, costs a lot more. It's happening more and more across America. And I don't think we're even close to seeing what the true costs of this program are, and it's probably going to be a few years until we really find out how much this is going to cost the American people and the taxpayers. When you take money from one segment of society and redistribute it to another segment of society, that's wealth redistribution, and that never works out for the good of anyone involved in that situation. I don't think we need to vote to repeal it 41 times. That seems a little bit silly to me. I think one vote to repeal is good enough. Everybody knows where you stand. I have some solutions that I think we could talk about. And again, in order to fix this healthcare problem, we're going to have to think outside the box and make some hard decisions. But we could repeal Obamacare and replace it with a true free market healthcare plan with less regulations and mandates. Let's get the federal government out of the healthcare business. We should decouple, optionally, your insurance plan from your employers. You should be able to go out and buy the health insurance coverage that you want from any insurance company that offers it anywhere in America. And that's your individual insurance, and that insurance stays with you whether you go from one employer to the next to the next. Too many people in our country are losing their health care because they're losing jobs. So why can't we fix that? And as long as you have your own policy, why don't we let you have, say, I don't know, up to $100,000 in tax-free health savings account savings. So in case of emergency, in case of catastrophe, you have that money there that you can use to cover that catastrophic event. One only needs to look at the surgery center of Oklahoma City. Go home tonight and look that place up. That place operates without government intrusion. They list the prices for all their services right on their website. You know exactly what you're going to pay when you walk in the door, and it's the lowest cost health care in the country.
Well, I think they should get the three of us in the room. I think we could solve this problem. The Affordable Care Act, rollout was awful. Does it do some good for some people? Absolutely. Some people that couldn't get coverage before can now get coverage. Kids up to the age of 26 are now covered under their parents' plans. Good thing. There's some bad things in the plan too. Jack lost his plan. The president promised those folks could keep their plan. That needs to be fixed. But there are other things in that plan that are great for North Dakota. Let's talk about the Frontier Amendment. The Frontier Amendment fixed the Medicare reimbursement rates in North Dakota. For those of you who don't know what that is, prior to the Affordable Care Act, North Dakota was getting reimbursed at approximately 75 to 85% of the standard Medicare reimbursement rate. Honestly, folks, it's one of the reasons that the big hospital in Fargo and the big hospital in Bismarck had to sell out to Sanford Health. It's one of the reasons, because the Medicare reimbursements were so low. And there's another part of the Affordable Care Act that has really benefited North Dakota and North Dakota citizens, and that's the expansion of Medicaid. The North Dakota legislature, 2/3 in both houses by the Republican Party and the governor, voted last year to expand the Medicaid program in North Dakota, bringing in approximately $85 million a year to North Dakota hospitals. You tie that to the $65 million that we got from the increase in Medicare reimbursements, and it's a huge number. And guess who pays those costs if we lose that care? Everybody in this room. When you go to the doctor, everybody else's costs will go up. But the doctors, the clinics, and the hospitals can't roll that back. Thank you.
Well, that